my name is Jasmine. I'm a Butler nursing student. Today we're going to be placing an NG tube. I'm going to be showing you the supplies that we need. We need a pair of gloves after. This isn't a sterile procedure, but it's still a clean procedure. So you'll be needing gloves after you perform hand hygiene. You'll need your NG tube. You'll need a clamp to clamp off the tube so the stomach contents don't go onto the patient or onto the floor. You'll need a towel in case the patient vomits. Germ-X hand hygiene. You'll need tape to measure your NG tube and to place the NG tube on the patient's face. You'll need lubricant for the NG tube. You'll need a syringe to aspirate some stomach contents to see if you're placed in the stomach for acidity. You'll also need something to measure the pH to see if you're in the lungs or not. And then a basin in case the patient feels like they need to vomit. And then a glass of water to ensure that the patient can swallow. Okay, so once you've gathered your supplies, you're going to want to go ahead and perform hand hygiene. Introduce yourself to your patient. Do your 2 patient identifiers. Ideally, you'd want to have the patient sit up at least 90 degrees or high Fowlers. So I'm going to go ahead and ask my patient to sit all the way up. Well, actually, before that, you can lay back down. Before that, you're going to want to check this patient's abdomen for distension, just to make sure that the order is correct. So you want to listen to, you're going to want to find no bowel sounds or hypoactive bowel sounds. So you want to hear in all 4 quadrants, and that's how you verify. Alright, now I'm going to have the patient sit up 90 degrees. Ask a couple of questions for your patient first. So, Guillermo, are you able to drink with a straw and swallow?
Yes.
Have you had any nasal surgery?
No.
Okay. So what we're going to place is an NG tube. Since your stomach is distended, we're going to get some of that stuff in your abdomen and in your stomach out. That way you can feel some comfort and relief, okay?
Alright.
Okay, so I'm going to go ahead and place some gloves. Now this may be an uncomfortable procedure. I'm just warning you. Have you ever had an NG tube placed?
No.
No? Okay. So it's basically a tube that goes from your nose to the back of your throat all the way into your stomach, okay? Okay, so I'm going to put this towel on your chest. If you feel like you need to stop, we can stop, but this towel is just in case you want to feel like, if you want to throw up, okay?
Understand.
I'm going to have you hold this basin with one hand. This is in case you want to throw up, so you can do that there. And then this cup of water so you can drink, okay? You can go ahead and just rest it. Okay. So I'm going to want to grab my tape. I would grab at least 1 piece for now. Well, we can grab 2. Usually I put it over here on the patient's towel. Hard to see. Okay. Now I'm going to go ahead and measure the patient's tube. So I'm going to take off your glasses for a second, okay? So I'm going to measure from their nose to their earlobe down, and I'm going to feel for their xiphoid process. And then I'm going to add 10 centimeters to that. So that's about 10 centimeters. And then I'm going to grab that tape that I had and mark the end of the tube. So ideally this is the location of the stomach. So that's why we're measuring it, so we know to stop there. Alright, so then I'm going to place some lubricant all over my tube. Alright, Guillermo, so this might be a little bit uncomfortable, okay? I'm going to go ahead and choose which nostril I'm going to do. So I'm going to have you breathe in and out. Breathe in and out. I think this side is less stuffed up, so we're going to go ahead and do that side. Okay, so first I'm going to have you lay your head back. Okay, so I'm going to go ahead and place this. When it gets to the back, you're going to want to have them tilt their head forward, and have them drink out of the cup. Drink, drink, drink. This makes it easier for the tube to go down. Now, when they're in the back, I'm going to have you go ah with a tongue depressor, and make sure with the pen light that the tube is in the back and it's not coiled up. If it's coiled up, then it's not going to go down your throat. Okay, you can close because we've insured. We're gonna have them keep on drinking. Keep on drinking, keep on drinking. Okay, now we've reached our tape, so that means that we're done. Okay, Guillermo, good job. We have the tube in place now, okay? I'm gonna go ahead and just tape it to your face. And you're not allergic to latex or to lubricant or adhesive from the tape, right?
No.
Okay. I would want to check that before when I'm gathering my supplies. Okay, I can go ahead and take this. You did really well. We're just going to check placement now, okay?
Alright.
So I'm going to, before I clamp my tube, I'll leave my clamp right there. I'm going to go ahead and verify that it's in the stomach by getting some of the stomach contents up. I'm going to go ahead and put it on a pH paper, and then I'd read the pH. The higher the pH, the more acidic, so it would mean that you're in this. Another test you can do is you can check your the CO2. So you'll want to hook it up to the CO2 monitor, wait a minute, and then the results are either yellow or purple. Purple means that indicates that there's CO2, so most likely you're in the lungs. And then yellow means that there's no CO2, you're probably in the stomach, which is good. Usually a lot of facilities order a KUB x-ray, which is an x-ray of their abdomen, just to make sure that placement is correct. So after you're all done, you'll go ahead and either lay the patient back down or sit them up. Usually just leave them sitting up, and then document as needed how the patient tolerated. Do you feel okay?
I feel alright.
Okay. Once we make sure everything's okay with your stomach, we can take this tube out, okay?
Alright.
And then make sure before you leave to clamp it, because you don't want the stomach contents going anywhere. And that's how you place an NG tube.